and I have with me Dr. Jaina Unadkar. Yeah, good afternoon, everyone. This is Dr. Poornima Mathur. With me, I have Dr. Jaina Unadkar. We are consultants at Oasis Fertility, Vadodara. Today, we are going to discuss how does fertility and aging go together. There's been such a hoo-ha about the age factor. We all know aging affects your fertility. उससे आपके pregnant होने के chances पे फर्क पड़ता है. But we've always focused on the problem कि हमारे पास इसका solution है, हमें क्या problems होती हैं, हम उनको कैसे tackle कर सकते हैं. आज हम लोग वो discuss करने वाले हैं. तो सबसे पहले we'll discuss how does.
Yes, ma'am. We would like to discuss about how does age affect the fertility? How does it affect our potential to conceive?
या बहुत इस बारे में डिस्कस हुआ है कि एज से हमारी फर्टिलिटी पोटेंशियल को अफेक्ट होता है. द बायोलॉजिकल क्लॉक जो टिक करती है. सो विथ हमारी एडवांस्ड एज हमारे जो ओवेरियन रिजर्व है, व्हेन वी आर टॉकिंग अबाउट फीमेल्स, द ओवेरियन रिजर्व्स आर रिड्यूस्ड. हमारे एग्स के नंबर एंड क्वालिटी वो दोनों रिड्यूस होने लगते हैं. हेंस हमारे चांसेस ऑफ कंसेप्शन कम होते हैं. एट द सेम टाइम देयर आर मेडिकल मॉर्बिडिटीज जो हमारे साथ एसोसिएट होती हैं अलॉन्ग विद एज. Hypertension, diabetes, and other comorbidities. Male में the sexual frequency reduces and hence the fertility outcome is affected.
Okay. So, ma'am, when will you say that the maternal age is advanced now? I mean, what will you say that this is the cutoff age, and we can guide her and we can say that you are in advanced stage?
Okay. So when it comes to advanced maternal age, अगर हम on papers जाएंगे तो it is 35 which is considered as advanced maternal age, जिसके बाद हमारे fertility treatments and pregnancies पे serious age का impact आता है. So but today's scenario में if we see, it is very common that we decide to get married or start our family at the age of 35. So having pregnancies at the age of 35 is very common. So we can actually be a little more flexible and consider it towards 38 and 40. अगर हम टेक्निकली लीगली देखेंगे तो women between 21 to 50 years, मतलब beyond 50 years, you cannot seek assisted reproductive techniques for pregnancy. And males जो beyond 55 years हैं, they cannot avail the ART services for conception.
Okay, thank you, ma'am. And please guide us that how a mother or a lady or a couple should consult a fertility doctor for that.
Okay, now we know when to consult a fertility doctor. It's a very genuine question. हमें पता होता है कि 1 year तक you've tried to conceive, अगर हमें conception नहीं हो रहा है तो that is infertility where you go and meet a doctor. क्या same हमारी timeline is followed when we are in the advanced stage section? So my recommendation would be, if you are in your late 30s, when you've crossed your 35 and you are planning to get married or you are planning for your family life, your pregnancy, you should always have a preconceptional counseling so that you are assessed, physical evaluation, and the doctor can guide you how to plan your fertility or your pregnancy in the later course. If in case you've been trying for pregnancy, the first 6 months, if you've tried for 6 months and you've not achieved pregnancy, that is when you go and consult a fertility doctor. But a preconceptional counseling is very mandatory so that you have a very clear view of what is your ovarian reserve, how should you plan your fertility approach in your subsequent months after marriage or in family planning. Is there any associated medical condition that needs to be regulated? Say for instance, अगर आप hypertensive हो, which is very common when we are in the late 30s with the recent हमारी stressful lifestyle है, your hypertension needs to be very well controlled if you want to achieve pregnancy and a healthy live birth. The medications जो है आपके physician change करेंगे which can be pregnancy friendly. अगर आप diabetic हैं, your diabetes जो blood sugar levels हैं, they need to be under controls to achieve a healthy pregnancy and a healthy baby.
Okay. Ma'am, what are the challenges that a couple can face if they have reached to an advanced stage?
Okay, so we can say that when a couple is in advanced age, is getting married and planning a pregnancy, so they can have problems during conception while achieving pregnancy, and the other one is while maintaining the pregnancy. So first thing is the ovarian reserve. Now the ovarian reserve जो है वो हमारा diminish होने लगता है with age, or the quality of the eggs is also compromised as the age advances. If we have addictions like smoking, tobacco, or alcohol, they can negatively impact आपके eggs की quality, hence your pregnancy outcome. So one is the egg की quality and उसके number. नेक्स्ट इज द यूट्राइन फैक्टर्स विद एज आपने देखा होगा फाइब्रॉइड्स होते हैं यूट्रस में द एंडोमेट्रियोसिस अगर आपको माइल्ड होता है दैट गेट्स एडवांस्ड विद लेटर एज दे कैन बी एसोसिएटेड एडिनोमायोसिस एनी pelvic inflammatory diseases अगर कोई इन्फेक्शन है these can also interfere with your pregnancy के chances. Now other would be the associated medical conditions that are there which can interfere with your pregnancy. So if you have any other medical comorbidities like thyroid, diabetes, hypertension or any autoimmune disease, उनको well control करना बहुत जरूरी है before you go ahead with pregnancy planning. When you are pregnant, your 9 months ka course would be a little more under vigilance as compared to someone with a younger pregnancy. So we need to watch out for gestational diabetes that can happen, gestational hypertension that can happen, baby ka growth restriction और बेबी के आसपास पानी कम होना, preterm labor. These are all the complications that are associated with advanced age. तो it is preferable if you conceived in your advanced age, आप एक tertiary care center पे अपना treatment continue करो where you can your pregnancy can be managed easily.
Okay. So, ma'am, for such patients or such couples, what treatment should be offered? What are the options for them?
So now when we come to fertility, the treatment options that we have. So the basic treatment protocols होते हैं कि हम सिर्फ egg बनने की medicine दें and आप natural family planning करो. ये IUI they are less effective when we are talking about couples with advanced age. So the early you seek ART techniques or IVF की help, the better is the outcome. Why is it important? Because the ovarian reserves are diminishing. जितना हम डिले करते रहेंगे the ovarian reserve can actually deplete and we might not be able to salvage self eggs. Now if in case we want to go ahead with self eggs, first is if you think कि your marriage is going to be postponed till 34-35 and उसके बाद you want to pregnancy in the later years, so you should think of fertility preservation right now. If we've crossed that age and we're already married and struggling, so we should be mentally prepared for it कि हमारे eggs कम हो सकते हैं but and quality affect हो सकती है. In that case, we can go ahead with double stimulation and embryo pooling. Now what is that? कि हम आपकी एक cycle stimulate करते हैं. Now normally अगर हमें 7 to 8 eggs मिल रहे हैं तो with somebody who's at 39, 40 or 41 years of age, तो वहाँ पे हो सकता है हमें सिर्फ 2 या 3 eggs मिले. And the chances of a euploid embryo, euploid मतलब genetically normal embryo, जैसे हमारी age advance होती है वैसे ही हमारे जेनेटिकली नॉर्मल एम्ब्रियो के चांसेस भी थोड़े से कम होते हैं. आपने पता है डाउन सिंड्रोम के चांसेस बढ़ जाते हैं, एनी जेनेटिक कोमोर्बिडिटीज के चांसेस बढ़ जाते हैं व्हेन द लेडी इज इन एडवांस एज. सो वी हैव टू टेक इन कंसिडरेशन दैट फैक्टर आल्सो. सो हाउ डू वी डील विद इट इज जब हमारा आपका हम एक आइडिया स्टिमुलेशन करते हैं, आपके 2 एग्स मिलते हैं, वी कैन हैव अ सेकंड स्टिमुलेशन और आपके एम्ब्रियोज पूल कर सकते हैं. व्हेन वी आर इन एडवांस्ड एज इट इज प्रेफरेबल कि हम ये एम्ब्रियोज की जेनेटिक स्क्रीनिंग करें. नाउ व्हाट इज जेनेटिक स्क्रीनिंग? दैट वी नो कि हमारी एडवांस्ड एज में इट इज वेरी कॉमन कि एन्यूप्लॉइडीज की क्रोमोसोम्स की प्रॉब्लम आ सकती है जिसकी वजह से हमें एक एबनॉर्मल फीटस हो सकता है. जब हम हमारे NIPT कराते हैं या हम 6 मंथ का स्कैन कराते हैं तब हमें पता चलता है कि बेबी में प्रॉब्लम है. इफ वी डू नॉट वांट दैट, वी कैन डू इज जब आपके एम्ब्रियो बनते हैं उस एम्ब्रियो की हम बायोप्सी लेके जेनेटिक टेस्ट कर सकते हैं. And when it is genetically normal आता है, only those embryos are transferred so that हमें 9 months पे healthy pregnancy achieve हो सके. अगर now this is one is we can go for double stimulation, embryo pooling. Now third is अगर हमारा egg reserve कम है and we want to maximize our chances, so there is another technique called ovarian rejuvenation. Excuse me. With ovarian rejuvenation हम आपके PRP दैट इज प्लेटेड रिच प्लाज्मा जो आपके ब्लड से कलेक्ट करते हैं एंड स्टेम सेल्स को हम इंजेक्ट करते हैं आपकी ओवरीज में. दिस वुड एक्टिवेट इट एंड इंटरनेशनल स्टडीज हैव शोन कि अराउंड 70% इंप्रूवमेंट होता है इन द नंबर ऑफ मेच्योर oocytes दैट इज मेच्योर एग्स मिलना, द क्वालिटी ऑफ एग्स मिलना एंड अ बेटर हेल्दी लाइफ प्रेगनेंसी रेट, लाइफ बर्थ रेट. So ovarian rejuvenation के बाद stimulation करके we can even proceed with that. Now what if we've actually reached a threshold where our ovaries are not working या हमने cycle कराई है and हमारे euploid embryo हमें नहीं मिल रहा है. Those who do not want to go through the ordeal of repeated injections or stimulations, so they can actually go for donor gametes as well. Now what is donor gametes is, we know कि हमारी सबसे ज़्यादा pregnancy का potential होता है around the age of 25 to 35. Now donor, जैसे अगर हमारा, if I am 40 and my egg reserves has diminished or I am not able to find a euploid embryo, there are people who donate their eggs. They are usually young healthy females between the ages of 25 to 35, जो जेनेटिकली नॉर्मल है, उनके ब्लड टेस्ट होते हैं, who have previous healthy pregnancies. Now these oocytes जो है, if they are injected with your husband's partner's sperms and the embryo is transferred, so इनसे आपकी pregnancy rate better हो जाती है. Plus, there is no worries about the genetic aneuploidies or chromosomal abnormalities. Hence, the assurance of a healthy live birth and a shorter time to conception interval. Now, if in case because of the age, we've also talked about कि हमारी एज के हिसाब से यूट्रस के ऊपर भी असर होता है. देयर इज फाइब्रॉइड और हमारा पीआईडी की वजह से एंडोमेट्रियम अफेक्ट हुआ है, और देयर इज सिवियर एडिनोमायोसिस. दैट इज व्हेन वी कैन एक्चुअली टेक द हेल्प ऑफ सरोगेट्स एज वेल. Now surrogates में, if your eggs are okay, हम आपका embryo बना के, they can be put in a third party, that is a third female, who will only carry your baby till 9 months, unlike what movie shows. So your embryo is made with the help of IVF and it is transferred into the uterus of a surrogate who carries the pregnancy to term for 9 months. So these are all the treatment options that are available at an advanced age. So, see, we've talked a lot about age and its effect, but let me tell it to you, all of you out there, कि if you are trying for pregnancy at the age beyond 35, around 40 years, there are many options with which we can actually help you achieve and realize your dream of parenthood. So just because आपको कोई कहता है कि you are 40, how are you going to conceive? This is the time जब नहीं होता. Please have optimism, have a healthy lifestyle. That is very, very important. It is eventually your health that matters. If you maintain a healthy lifestyle, have activity, any physical activities. For some people, it might be sports, gymming, running, cycling, yoga, to maintain your physical health. You eat a healthy diet, antioxidant rich diet, and you timely consult the fertility doctor, you can easily realize your dream of parenthood. Thank,
Thank you
thank
so
you
much,
so
ma'am.
much.
Thank you.
Any questions? So we have all the how common is pregnancy after the 50s. Spontaneous conception after the age of 50 is actually very, very low, even less than 5%. The pregnancy after the age of 50 is, we cannot use ART for a lady who's crossed the age of 50 as per the new ART law. And the chances of natural conception are very low. So it is not advisable to go ahead with IVF after the age of 50. What age is riskiest to get pregnant? There's nothing called riskiest to get pregnant. The risk starts increasing when you've crossed the age of 35. And as your age advances, and a lot depends upon your associated medical comorbidities, that the risk of pregnancy increases. The sperm count. Now, men on the to the very contrary, जब हम biological clock की बात करते हैं, men are very least affected with the biological clock. You must have heard when people who are 70 or 80 having their babies. So men की sperm count is, if the guy is having a healthy lifestyle, the sperm count would not be affected. He can actually have a very good sperm production rate throughout his life. The quality might be affected depending upon his lifestyle or his addictions or any diseases that he has. So men are usually untouched with the age factor. Um, what age?
At what age does sperm come out of a man?
To answer this. So once the guy hits puberty and they started ejaculation, they have the potential to impregnate a woman. We have one more question. Will IVM be useful for a lady who is 43 years with 3 IVF failures? Did not implant even PGT checked embryo, hysteroscopic normal and good endometrium and AMH4. See, it would be a very individual. You've had previous three IVF failures, so a lot would depend upon what was your ovarian response, and what was the quality of the eggs, what was the blastocyst grading, and how were they transferred. Did you have any associated? Did you get EDA testing done or not? What were the associated drugs used? IVM might help you, but it would be a very individualized answer that we can actually give you. If you want, you can share your reports with us and we will get back to you and give you a call regarding what will work best for you. Thank you so much. If you have any queries, please feel free to call our helpline. We are ready to offer all consultations to you. Video consultations also available, and we offer all array of services, including ovarian rejuvenation, fertility preservation, PGS, advanced semen preparations at Oasis Fertility. Thank you so much.
Thank you.